Um, it has been a most interesting and timely and certainly very informative conference. So we've heard from dozens of wonderful and passionate advocacy leaders, labor leaders, practitioners, academics, policy experts, international organizations, directors, and state and local government officials talk about their work, their ideas, their research, and experiences. In fact, they have left us many food for thought, well as questions to ponder. I have the honor now to introduce the closing plenary speakers and moderate this last session of this very timely and interesting conference on the U.S. care infrastructure from promise to reality. I'm Maria Floro, Professor Emerita of American Universities, and I have the honor to introduce the following speakers. Wendy Chun-Hoon is the director of the Women's Bureau, and before her current position, Wendy led the Family Values at Work, a national network of grassroots coalitions that have won new paid leave for about 55 million workers, and also has been organizing for broader access to childcare, fair wages, and decent employment conditions for workers. She also spearheaded the development of the Family Justice Network. Nancy Folbre is an eminent feminist economist, a professor emerita of economics and director of the Perry's Program on Gender and Care Work at University of Massachusetts at Amherst. She was a member of the advisory board of the AU Care Work and the Economy Project and is a senior fellow of the Levy Economics Institute. A well-known feminist economist, she has published many articles, reports, and books exploring the interface between political economy and feminist theory, with special emphasis on the value of unpaid care. Josie Kalipeni, who hopefully will be joining us shortly, is the current executive director of Family Values at Work. She was born in Malawi, and she has worked in policy advocacy, organizing, and strategy development over the past 2 decades in one of the poorest countries, as well as on the richest country in the world, to address the needs of those marginalized. And last but not least, we have Carolyn Pincus, Director of Strategy for the American Sustainable Business Network. Prior to joining the American Sustainable Business Network, Carolyn was a small business owner with 15 years experience in the food and beverage industry. So the way we're doing the closing plenary is that I'm going to ask questions to our panel speakers. So I'll start with the general questions to all of you. What, in your view, are the most important challenges related to the provisioning of care services that are faced by the United States and the world in general today? So anybody who wants to start? Wendy, you want to start? Go ahead.
I can start. Thank you. Thank you so much, American University and Institute for Women's Policy Research and the Care Work Network for bringing us all together over the past 2 days, and also for inviting me to join this awesome panel of leaders to help to try to culminate the 2 days that we've spent together. You know, I know everyone here is looking to leverage this moment and really create a robust care infrastructure that works for all of us. So I would say that one of the biggest challenges we face is the impact the pandemic has had on the care workforce, which has an absolute rippling effect on workers and the entire US economy. And the other thing I would say is that we all knew it was coming. You know, COVID just grossly underscored the challenges that women already faced in the labor market and at home. And I know many of these issues have been talked about over the last 2 days. I just think they bear repeating again and again. We know that women are more likely to be the primary caregivers for kids and other family members. We know that they're more likely to take time away from work to provide this care. We know that when women take time out of the labor force to provide unpaid care, but essential care, there's a negative impact on their current earnings, but also their future earnings. And I just want to say now the Women's Bureau is working right now with the Urban Institute to try to quantify that lifetime cost of unpaid caregiving, both to women and to their families. We knew that quality, affordable care costs way more than families can afford. So I think, you know, as a result of the pandemic and the impact to people's access to care, we're experiencing one of the lowest female labor force participations that we've seen in 3 decades. Those who left the labor force did so to provide care for their kids, as many care centers have permanently shuttered, right? Making it even harder to find care. 1 in 10 childcare jobs are still missing. The loss of jobs in the care sector is way beyond childcare. Nursing and residential care have fared in some cases even worse. I think 14% lower employment compared to pre-pandemic. Even as recent as January, more than 5 million women lived in households where kids under age 5, so that's a household like mine, were unable to attend daycare or another childcare arrangement within sometime in the past 4 weeks. And nearly all the employment losses among moms were among moms with kids under the age of 13. So enormous, enormous disruption and impact.
Thank you. Carolyn.
Okay, sure. Hi, everyone. My name is Carolyn Pincus, and I just wanted to also thank American University and the Institute for Women's Policy Research for holding this conference. It's been fantastic. And I just, in terms of the question, want to echo what Wendy just mentioned. Of course, the pandemic, you know, is exactly exposing the challenges that we already, you know, we're seeing in the workforce, and you know, has just really demonstrated the need for this kind of, you know, these kinds of conversations on how to ensure that, you know, workers, that small businesses and so forth are all, you know, part of this conversation and part of the decision making. I would say additional challenges, you know, in terms of especially part-time workers. I think, you know, as a former small business owner, I, you know, we had a restaurant group in the city for 12 years with 5 different venues, and, you know, the frustration of wanting to provide for our workers and not being able to because of the constraints that I'm sure this conference, you know, has talked about at length, was just frustrating. And especially, you know, for small business owners who consider their workers, you know, part of a larger family, and wanting to make sure that people have what they need in order to, you know, show up for work and also to show up in their lives. You know, I think that this is a really important challenge that I think, you know, we need to address is this, you know, part-time workers. And, you know, the other challenge that I think is a little bit different, maybe, and slightly out of scope, maybe, but, you know, sort of how we think about risk in this country. You know, the American Sustainable Business Network, we work with businesses and investor groups alike that are interested in redefining what we consider risk to investors, right? So if a company is not providing care, if a company is not, you know, considering what I believe the SEC is calling human capital needs, right? What does that mean in terms of their risk profile? And you know, how can we, you know, as a business member organization, how can ASBN, you know, influence that rulemaking as it comes down the pipeline? So I would say those are the additional challenges in addition to what Wendy said.
Thank you, Carolyn. Nancy.
So I think I'm going to speak kind of to the challenge facing us as a group here at the conference looking forward. And I think we're on a really good path. I thought the best aspect of the meeting was that it brought together academic researchers and policy experts and activists and union reps and the business community. I mean, I think this is really the way that we need to move forward. And I also think we really need to just hang tough and get through our primal screams, which have been mentioned. You know, we're in a kind of a tough political environment, but I think we have to really have faith in this larger vision of a more caring and more sustainable economy. I think kind of conceptually, I think the challenge, and this is also a political challenge, is to overcome some of the silos that I felt like were still in effect, like paid versus unpaid care. We're kind of bridging that, but there's still a big gap between thinking about childcare and elder care. They're treated separately, even though they're sort of competing. I always love that slogan, caring across generations, because I think it conveys the need to look at the generations together. But I think we're still, most of us specializing in one or the other, and we need to try to overcome that. And there's a third kind of silo thing that I want to put forward, which is separating care from healthcare. I think we should cut that out. I think the two are very related, that we can learn a lot from the dysfunctions of our current healthcare systems and attempt to reform it and the care picture. And I think we would gain from bringing the healthcare community into a larger discourse about what care work and care provision has in common. So those are some challenges for those of you who are here and plan to keep thinking and working on these issues.
Thank you. So now I'm going to go to the second question, a follow-up one. As a country, oh, sorry, Josie, thank you for joining us. So you're just, so I would just asking the question, what in your view are the most important challenges related to the provisioning of care services that are faced by the United States and the world in general today?
Yeah, that's a great question. My name is Josie Kalipeni. I'm the Executive Director of Family Values at Work. I'm so happy to be here. I think this might be my third IWPR conference. I'm always so happy to be doing these, and a little bit of normalcy feels really good. So it's great to be with you all today. I really love this question. It makes my mind go in 8 million directions, particularly because the moment around us is constantly changing and at the same time not changing. So it feels like a strange question, but a good question. You know, I think a few of the challenges that I would love to highlight is that, you know, care and caregiving is a silent driver of inequality and multi-generational poverty. Like it feels silent, it feels quiet, it feels unseen unless you're right in the thick of it. And oftentimes by the time you're in the thick of it, it's too late to sort of see it and problem solve around it. So the idea that our country is not yet fully awakened to the idea that this is one of the key drivers of inequality and multi-generational poverty is a huge challenge that we have to wake up to. And I will just give a small example of how it leads to multi-generational poverty. We can't see it as a single generation issue. So when I think about the care I have to provide for my mom, I have to think about that in context of everything else that's going on in my life. So I have a good job, I'm making, you know, good and decent money, and I'm trying to save up to eliminate my debt, because I know as you age and need care, debt is a huge factor. I'm saving up to try to buy a house because I know housing is a huge issue as you age and need care. At the same time, my mom needs care and was the one who signed college loans for us, so she has her own debt. So when she needs care, I have to step in financially. My siblings have to step in financially. We have to disrupt our careers and work and workflows, which means the savings that we're able to put aside automatically gets redirected to her immediate needs, taking away from my own savings and ability to save up from the things that we know lead to a level of economic security and wealth. So if I'm not saving, then when I need care, my savings aren't there for me. I've depleted my savings for the savings my mom didn't have for her own care. So it's not like she has out-of-pocket money to send to me for my own care. So not only is her care financially compromised, but now because I have to, want to, and I'm expected to step into her provision of care, now I don't have savings and the income necessary to provide her care. So looking at care and caregiving, we have to look at it as the silent driver of inequality, and we have to look at it from multiple generations, the impact it has on multiple generations. The math just doesn't add up. So that's a key challenge. The other thing I would say is that everyone has a role to play in this issue, in the advocacy and policy making. If you're working in an agency, we have to think about it from implementation. If you're an employer, if you're an employee, much to Nancy's point, the idea that we would bring together multiple stakeholders to have this conversation is critical, because there's a role for everyone to play in figuring out the solution to this problem. And oftentimes that's not evident until you're in the moment of crisis and you have that sort of like aha moment of, shoot, this is what I should have been doing, whether it was in my work, in my advocacy, the tough conversations in my family, but everyone has a role to play. This is one of those issues that impacts everybody. And if we can all have the meaningful conversations and really catalyze our power, then we can really change this moving forward. The other thing I will say that is a challenge, a recent challenge that I'm thinking about, is about where the centers of power are in figuring out the solutions for this. So I oftentimes hear about the solutions that employers need to make. And then we spent, a little over a year, almost 2 years, thinking that the center of power is solely in DC. And before then, Family Values at Work spent a lot of time creating the center of power in states and state advocacy, state policy, and state implementation. And the reality is, like, all of these have a level of power. States are always poised to figure out solutions that can then be fed up to the federal level. Employers have levers that they can pull on to be solution makers and to implement experiments within the workplace to see what works for working caregivers. So there isn't a center of power that's going to figure this out. It's going to require all of us at the state level, local level, federal level, at the kitchen table, and it's all of us coming together to really figure this stuff out. I think lastly, and maybe most importantly to me, as a childless working woman of color who's an immigrant, who's trying to figure out family planning, who's trying to figure out care for my family, my mom, my siblings, all of those things, the issues that we're often talking about are always impacting all of the same folks. So the center of impact is always the same folks. When we're talking about the wage gap, when we're talking about lack of opportunities within the workplaces, when we're talking about discrimination, when we're talking about lack of paid family and medical leave, we're talking about the same people that we then rely on to provide care and to figure out how to sustainably do so. And this is a big, 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 big problem. Not only are we going to burn out, not only are folks already burning out as caregivers, but the issues that we're talking about exacerbate the same individuals, the same families, and create this sort of perpetual cycle of poverty that we have to figure out how to break if we're going to disrupt the trajectory of economic stability for families in this country.
Thank you. Thank you, Josie. So I'm going to have a follow-up question. Clearly, we have such huge challenges ahead of us. And as a country with hundreds of thousands of families struggling to meet their care needs, like many of you, there is clearly need for bold solutions. So I want to hear what bold solutions addressing these challenges and problems would you recommend in order to attain affordable, quality care for all? Anybody wants to start? I'm going to be, why don't we start with Carolyn? Carolyn, go ahead.
Okay. So let's see, I think I may go from like the moderately bold to the bold here, just to give us, just because I think you know, it's good to ground in stuff that's a little bit more, you know, coming down the pipeline, so to speak. But then also I completely agree with the framing of this question, that we need to look beyond, you know, these, we need to look beyond, you know, certainly I can speak for myself. I need to look beyond, you know, the immediate short-term sort of goals that we have at our organization, and need to look more broadly, you know, into really centering in that type of bold thinking. So, you know, something that I do think is incredibly important from the business perspective is to be looking at alternative forms of ownership. And while there have been a lot, there's just, you know, it's been decades and decades of work in this area. I still don't really believe that this has been embraced as more of a mainstream solution. You know, alternative forms of ownership can provide workers with the needed, you know, sort of the needed power and the needed sovereignty in order to be able to make decisions about their lives. You know, I mean, I remember just from years ago when I was working, you know, for someone else, and I needed to take time off for something, and he said, you know, this is your life, you have to go do it, you know. And so making sure that, you know, we're considering these types of solutions, I think is really important. And you know, we endorse this bill, you know, Capital for Cooperatives, to be able to, you know, incentivize cooperative formations, to be able to provide that for workers. You know, the other sort of moderately bold, but something that I do think hasn't been, I'm hoping that more will join this conversation, is around what I just spoke of before in terms of ESG and how we're calculating risk in the larger economy. Just from my perspective, and I can only speak for myself, you know, what I see is so much interest in the small and mid-sized business community to be able to have these conversations about how we're defining risk in the S category. You know, and I think it really just, you know, ASBM's position, of course, is that, you know, we advocate for mandatory standardized disclosure. You know, it can't just be something that companies are putting on their website. We care about workers and so forth. You know, it really needs to be something that goes through audit committees and all this stuff, is, you know, as regular financial forms do. So, so those are sort of, I think, in terms of areas where I think we can work together, those are areas coming down the pipeline. In terms of a bolder solutions, I think, you know, it's really about this narrative shift that I'm sure has come up in the conference, right? So, you know, we are in the midst of this major transformation of how we work in our economy. What does it mean to work in our economy? What is, you know, what are the priorities of our economy, and how does this transformation of work, you know, factor into that? You know, this big transition to working from home, and, you know, that's been my experience. You know, we're in the midst of this transition, and I think, you know, highlighting the need that we have to be looking at this now and into the future of how this is impacting workers. And, you know, assessing in terms of care and the care infrastructure within that transformation and that transition that we're going through right now. I think the narrative shift, you know, really can come from business. You know, we work with so many fantastic companies that care deeply about this issue and want to use their voice, but also it almost feels like sometimes the conversation hasn't really begun yet. And so I think that, you know, having this conversation to say, you know, what is actually, you know, best for a small business, let's say, you know, how many hours are really required to perform that job in order for a business to be successful in the goals, you know, if it's, you know, a traditional business or mission driven, you know, I don't know exactly how to break all this up, but the more and more that I'm in this space, the more that I find businesses, you know, of all kinds across all sectors, all industries, and especially, you know, women-owned businesses, you know, who a lot of the times are sole proprietorships, working in the service sector, right, that care deeply about being part of this conversation and would love to be included in this conversation. So I don't know if I'm proposing a bold solution or just the need for some boldness in these conversations to talk, to rethink what we expect of work and what we, you know, expect in our lives. That's what I, you know, would offer to this panel.
Thank you, Carolyn. Nancy, like to go?
What was I going to say? You know, I was really struck by what Josie said about the silent driver of inequality. But I also think it's true that inequality in the US is a lot of the problem. It makes it really hard for us to work together, and it exacerbates a lot of divisions. And so I guess I'm in favor of really rethinking our whole social insurance system. I think the structure of it right now, the structure of it itself makes it really hard for us to create a coalition for better care provision, because it's separated those who can pay from those who can't, those who are old from those who are young, you know, those who are working for pay and those who are working at home. And so without, you know, it's not that I don't think that specific like state level programs about better social, you know, better programs or better reform of Medicaid or better, you know, better state level paid family leave policies. I think that's actually an arena for bold political action. But I think on the conceptual level, the bold conceptual level, I'd like to see us think about a social insurance system that is truly efficient and truly caring and truly sustainable. And I think, wow, it's a really huge task to think that big, but I think it could help move us forward.
Thank you, Nancy. Wendy, go ahead.
So I'm still thinking, Carolyn, about what you said. You said it was sort of your moderate version of bold, but I am still thinking about it, the narrative shift around risk. I think you're right, that is a place where business can lead. And that's not often a place that I come from. So it made me think about the whole conversation that we're having about supply chain and a lot of the narrative that gets stuck in, we are in a labor supply shortage. We're in a good job shortage. And what does it mean, you know, to think about good jobs in critical supply chain sectors? What does it take to address backups in the ports? Why aren't women in trucking? Why aren't, you know, what happens when you're working around the clock shift at a hospital, at a warehouse? And just how inextricably linked the built infrastructure is with the care infrastructure. So I think those kinds of, you know, those kinds of real narrative shifts, we should be exploiting them. So I, you know, as the government voice on the panel, the federal government voice on the panel, you know, I'm also just want to, I think it's worth reflecting that, you know, the State of the Union, the president was very clear about the undone business around the care infrastructure, that we need paid leave, point final, right? Like we need childcare, we need elder care. He's been very clear about that. This administration's been very clear about that. And I think it's because of the background I probably have in organizing and in state-based reform that has me, from the federal level, seeing the amount of money that is going to be infused into the economy to create jobs through the built infrastructure, the rebuilding of American infrastructure, and to understand how much discretion will be at the state and local levels to use that money and to use it for equity, to see more women and women of color getting into the kinds of jobs that are decent paying jobs with benefits, especially if they're unionized, and to think about, again, the discretion that sits with the states right now. And so this, Nancy Alt has come back to what you and Josie said in response to the first question about who has been a part of this conversation, how much more we need to magnify these conversations between state policy decision makers, federal decision makers, the advocacy sphere, the research sphere, bring it all together in this moment to really focus on how we spend this money with equity. So the number of states that have taken the, yes, temporary, right, not permanent, not the kinds of permanent investments we need in care, but important investments nonetheless through the American Rescue Plan, stabilization grants, and how many states did actually have used that money to increase wages in the care sector, to make sure that families have greater access to affordable care in this moment, to understand that lack of access to that kind of care means that you're not going back to work and what that does to the economy. So, looking at the state and local funds, the Treasury has just issued final guidance on state and local funds, is, making very soon that second tranche of investment into states. And again, the power of state decision-making in this moment to use those funds for their intended purpose, which includes things like paying for care, things like ameliorating what is keeping families out of the workplace, the lack of care. So there is an incredible amount of decision-making on the workforce development side. There are monies out there that sort of get listed as supportive services. And the ways that you can use those dollars, whether it's through WIOA or federal highway funding, transportation funding, education funding for supportive services, is very broad. It could be for job training. It could also be for the kinds of wraparound care supports, including childcare, that folks need to be successful in training programs. And then as they get into that pipeline to the better job. So I think, everyone has a role to play in this. The advocates, the activists in this meeting, the research teams in this meeting, the policymakers who are hearing and participating in these conversations. There is a lot of money moving into states that is flexible and at state discretion. And I think these are the kinds of things that get us to a more equitable society.
Thank you, Wendy. Josie.
Yeah, I'm having a hard time in my head rolling between bold and transformational, because I don't necessarily think they're the same. So I'm like rolling that around in my head. I would also say that a lot of the policy solutions that we're talking about today, paid family leave, paid family medical leave, affordable childcare, equitable worker wages, they're not bold policies. They're common sense policies. And we see caregiving families making this stuff work all the time, so it's not bold. And I would go even a step further by saying, not only is it not bold, it's not impossible. We saw this country enact, however temporary, many of these things that we're talking about in the onset of the pandemic. We saw childcare tax credits. We saw money going to states and employers for paid family and medical leave. We saw employers figure out flexible ways to make work for people when they had to work at home. We saw all of these things happen. It's not bold, it's not impossible, and we've seen it happen. I would say what feels like a bold charge is for us not to forget that we saw it happen, right? And to call into account the fact that we can do it. Because one of the things that always comes up is we can't do it. And 8 million reasons why we can't do it. We can't afford to do it. And it's too, big, and it's too much to implement. And it's too, all of these things. And the reality is we saw it happen, right? And then the other thing to me that actually feels bold is a nuance in this moment. And a lot of what we're talking about, the idea of looking at people's experiences holistically feels bold. Looking at somebody's humanity and experience in a non-siloed and total way feels bold. The idea that we wouldn't ask families to choose between childcare and elder care feels bold, right? We've been in political and policy moments where we've had to tee up what comes first. And that feels really challenging. And what feels bold is the idea that folks should have all of this in a way that's accessible and affordable, and in a way that's not arduous to apply. I mean, coming from a social work background, I know people who needed paid family and medical leave just to re-up their SNAP benefits, but they couldn't leave for an appointment to demonstrate all of the ways they're still eligible for the benefits that they need. So the idea that this should be easier and more streamlined for families, we should think about multiple points of eligibility for public programs is huge. And I think really thinking about that from a user experience is what feels really bold to me in this moment. And the other thing that feels bold is the commission to not forget that this country did move, and it moved swiftly, and it moved swiftly into doing things differently, right? Again, however temporary, however short term, right? So like holding on to that feels really, really bold. And political courage in this moment also feels bold when it shouldn't feel bold. But the idea that people do what's right with money at the state level that's being allocated to specific things, that money shouldn't be shifted and hidden and reallocated to other things at the state level, the idea that we should enact policies that we know work, that policymakers at the local, state, and federal level should enact policies that work despite party politics. Like the idea of political courage feels bold in this moment. And lastly, I'll just go back to something Carolyn started about narrative. To me, it's beyond narrative, and it's really about changing the posture of this culture towards care and valuing care. I think what feels bold is the idea of building a collective belief that everyone should have what they need to live, work, and thrive. Whatever that is, you know, the idea that we would collectively hold that together, regardless of income, race, gender, sexuality, family dynamics, family definition, zip code, all of that. The idea that no matter where you are, no matter who you are, you should be able to live, work, and thrive, and that everyone, our governments are responsible for creating an environment, an atmosphere where people can live, work, and thrive on their own terms. Us holding on to that collective belief feels like the boldest thing that we can do together moving forward.
Thank you. So I'm going to move now to fascinating answers. But I'm going to now follow up some points that each of you have raised. So I'll start with you, Josie. You're so passionate about the issue of addressing inequality. So the common sense policies that we have already achieved somewhat, right? But also moving forward into developing a collective belief of valuing care. How, in that aspect, what specific steps would you take or should be taken to address the inclusivity of any of those policies, to address the issue of inequality, whether it be childcare, elder care, and how can we ensure that all of these programs and policies address the particular needs of the Black, Indigenous, immigrants, and people of color?
Yeah, thanks for that question. I think there's a few things that feel very obvious to me. First, I think making sure that the folks most impacted are centered in every element of what we're talking about. And I mean every element, from research and research design to policy and policy design, to thinking about implementation, to thinking about state and federal politics. If we don't have caregivers on state commission panels that are thinking about paid family and medical leave, we're going to get it wrong. And so really centering the people most impacted is one of the steps that we can take to ensure equity, to ensure that programs actually work for the people that are most impacted by it. The other thing I would say is that we have to look at our work in a full cycle of work that includes implementation. This is so key and critical to the way that we do work. It's easy to sort of celebrate a state win or a federal win and forget to follow its implementation. And oftentimes where we lose infinite impact is at implementation. So I've seen, having worked in state organizing, I've seen wins at the state ballots and win in state legislature that then goes to implementation and gets held up, gets delayed, gets stripped in implementation, and the actual provisions that are won aren't followed all the way through to the point of impact at implementation. So when I think about inclusion, we have to think about implementation. And then I think we also have to think about the idea and hold true to the notion that benefits to people who need the benefits don't have to come at the cost of benefits to workers. We've seen oftentimes the trade-off to increased access to affordable childcare coming at the cost of lowering worker wages and lowering worker benefits. And this just creates a cycle where then you're stripping the industry of qualified workers, and you are having trouble recruiting and retaining workers because the benefits aren't in the industries and in the jobs there. So we have to hold true to the fact that worker benefits and consumer benefits don't come at the cost of each other at all, right? And I believe that we can do it. And I have an abundance mindset. I believe it means changing how we think about and how we're knowledgeable about our tax structures and what the return on investment is. I think it means re-looking at our current social infrastructure systems, the existence of or non-existence of, and reimagining it, Nancy. But I really think that if we do all of this, centering the folks most impacted intentionally, not symbolically, not as a checkpoint in the research process or in the policy design process, the people closest to the problems are often closest to the solutions. They're already working solutions that work, right? And so what does it mean to take their experiences in an expertise way and design it into research, design it into policy design it into implementation? So I think we have to think about that intentionally and critically.
Thank you, Josie. Wendy, I'll follow up with a question addressed to you. So if we're talking about the care sector being the leader of job creation, especially for women, I'm going to now go directly to the issue of policies. What policies would you recommend to ensure that rights of care workers are protected, that they receive decent pay and have decent working conditions?
Yeah.
Go ahead.
Yeah, thank you. And Josie, always so inspired to be in conversation with you. I think I said this earlier, but we cannot forget the thing that we've all felt over the past several years. Maybe the central lesson of the pandemic is how interconnected we all are. The labor of folks who are caring for our kids, our disabled, our older adults, is the infrastructure that allows everybody else to maintain their ties to paid employment. So, yes, care sector has always been a source of job creation for women, but the jobs are vastly undervalued and, backbone of our economy, and yet women cannot, they're earning the lowest wages of the economy, every occupation. Almost twice as likely to be below poverty line compared to workers in other sectors. Far less than a decent wage. And nursing and residential care jobs, also lowest wages, lowest benefits, despite the essential nature of the work. So I just think, the pandemic has been this giant mirror reflecting back to us how deeply we have undervalued, the unrealistic expectations about how people work, how they live, the gendered, racialized norms that shape the workplace, our families. So while, we just came off Jobs Day on Friday, and a lot of the discussion is about how the economy has been improving, unemployment's gone down, true. But women have absolutely recovered more slowly than men. Black women's employment has recovered the least because of this whole picture that I just painted. So, I think, we can't afford not to invest in the care sector. We can't in order for our economy to thrive, we have to have a robust care infrastructure. We have to make sure that these jobs are good paying jobs. As we, march, a lot of the discussion soon is going to start to turn to this unfortunate commemoration of what we call Equal Pay Day, which is not the whole story, but allows us to really elevate not just pay discrimination, but what drives the gender and racial wage gap, including the fact that majority of women are in these very low paying jobs. So I think until we address that and robustly, it is the imperative that we have to advance through any spending, through any public policy. We have to advance this now.
Thank you, Wendy. Now I'm going to go to Carolyn, and you have your experience in as a woman, a small business woman. I'd like to hear, but at the same time, you raise these alternative models of service delivery. So I'm very interested to know how you can, this alternative service delivery, what's their role in meeting the care needs of the population, but also how can it ensure the quality care in terms of provisioning, and at the same time, you don't want that quality care cost, the cost of providing that to be shouldered by the recipients, by the families. Otherwise, you will exclude the low-income and vulnerable people, families. So, any suggestions on who will bear the cost of ensuring quality care if they're not going to be passed on to the families of young children and disabled and the sick and frail elderly?
So I think I understand what you're asking. So I guess I'll answer it in a few different ways. So first, I think that, when we talk about the business landscape and the marketplace at large, I think what I've noticed is that, the business landscape is not this uniform mass, that, and the same goes for market and marketplace activities. So, even before we address alternative models, it just needs to be said that, business, a lot of times in these conversations is seen through these lenses that have been propped up by, I don't know, the U.S. Chamber of Commerce or what have you, that the business voice has been stripped down into sort of a single line narrative that if, market dynamics, regulatory landscape has to be centered in profit at all costs, centered on extractive practices, and, the activities that incentivize those profits, all of that sort of needs to be dispelled in a conversation like this, because I just hesitate to say, alternative models when there's a lot of, traditional, like recognized models in the United States that are owned by women of color, by, immigrant populate, but what have you, whether it's these sole proprietorships, small businesses. And I do, ASBN strongly supports, needing to think creatively about alternative forms of ownership, but also to say that, I don't think there's this single line or single responsibility, let's say. I think, we work with a lot of women business owners who, this is a primary concern for their employees, and it was a primary concern of my own, speaking from my own experience. And so the role that we would play, largely would have to do around advocacy, right? These state-based policies that, have been mentioned in this conversation, promoting those solutions, you know, and saying we are willing to build in these costs in our model. That's not a problem, but we need to be met. You know, you are our elected official, you work, you know, and it is incumbent upon all of us to work together and make sure that if these costs are built into our model, what's on the other end? You know, how can we make sure that there aren't bad actors that are also taking advantage in ways that, you know, we can't, you know, I mean, we can't really speculate, you know, but I think that, you know, that's largely different, right, than larger companies, let's say, that would have a different view of their bottom line and what they can do. I mean, in terms of alternative ownership models, I mean, I think in terms of care anyways, this was a little bit before my time in the organization, but I believe that, you know, we worked closely with this, the Cooperative for Care Associates in the Bronx, which I don't know if that was mentioned in this conference, but, you know, I think that that is a very solid model, right? It's been around since the 80s, I think, so 35, 40 years, something like that, right? Delivering care throughout Manhattan, the Bronx, Brooklyn. You see the benefits of worker ownership. You see the benefits there in terms of offering training in the community. You see the benefits of employment opportunities in those communities. And then, of course, the actual service delivery. So I think a model like that would be, you know, something to really take a look at. I know there's also a newly formed organization, Healthcare Anchor Network, right, looking at supply chain. And thank you for the, I think somebody put that link in the chat. Okay, so, you know, I think, you know, looking at those kinds of things without getting too wonky, you know, right, those are areas where there are leverage points that are available to us and, you know, everybody that's involved in this movement. To be able to exploit those leverage points, to be able to shift, you know, to be able to see these kinds of changes that we want to see. And what, you know, Josie said, you know, I strongly agree with, you know, live, work, thrive, I believe, right? Those, you know, that I think is prioritized for the, you know, for all of the businesses, certainly that ASBN works with, right? You know, it is not, and so that's why I opened with that caveat to say that, you know, the role of businesses is going to be different depending on what type of business, who owns the business, who operates the business, the model of the business, what sector the business is in, what industry the business is in, where in the supply chain they sit, and so forth and so on, right? Those, and it's not to deflect the question, but just to say that there are a lot of different ways to answer that question. And so we need to be thinking about it with the same complexity that we think about everything else in terms of care infrastructure, right? So I guess that's how I would answer that for now. I hope that is the right answer.
Thank you, Carolyn. Nancy, I'm going to follow up your point about the bold solution that we need, which is the social insurance. So clearly there is an important role of the government. What exactly do you envision is this role of the government? And as a follow-up, since we're, you know, I'd like to give others a chance to ask the question. Clearly, social insurance requires fiscal space. Where will this money come from?
All right, so it's such a big and such an important question. But I think the way to think about well, let me just start with some really big words, big ideas. You know, I think markets are really good at doing some things. They're really good at allocating resources that people can see, that are individual, where individual choice plays a really good role. Markets are just not very good at allocating care because consumers don't have sovereignty, and a lot of the benefits of care provision are environmental, they're ecological. And I think as much as I like the term care infrastructure, I think we should also think about the term social climate. The fact that our social climate, like our physical climate, is deteriorating, that it's subject to a lot of insults and a lot of toxins that we don't really understand. And not just for children and the elderly, but for adults who are suicidal or depressed or abusing drugs or you know, not thriving, right? And so I think the role of government is to help us solve problems that require cooperation. And these environmental problems of climate, of social climate, and of physical climate require cooperation. Competition doesn't work. And in fact, competition can often become a driving force of degradation of the physical and social environment. And I think I put a tremendous amount of blame for our current circumstances on the economics profession for its obsession with markets and its overconfidence in markets as self-regulating and self-sustaining. And so we'll need to go beyond that. And one other thing I'll say about the fiscal space, I think sometimes we think of it in terms of taxing the rich or spreading the burden sort of along class lines, but I think we should recognize that there's a larger issue of how we are going to divide our resources between some very important competing demands, the care of the sick, the care of the elderly, and the care of children. And what we need is some kind of a social insurance system in which we define the shares of total social output that we're going to decide collectively to define, to devote to social reproduction, rather than just going about it in an ad hoc way and saying, okay, we're going to give an absolute guarantee to this group, the elderly, of income support in old age, and everybody else can catch as catch can. And so this really requires moving beyond this traditional framework of rich and poor, because however important it is, there are really significant issues of life cycle, of care over the life cycle, and developing a kind of, you know, how do we as a social family think about how we want to insure one another against these various kinds of care risks, right? And I think we really need to start having that conversation to demonstrate that that we could design cooperatively and democratically a really good social insurance system, and it would look very, very different from the world we live in today.
Thank you. I'm going to now open the floor for questions. So anybody in the audience like to ask question? Yes, go ahead. Please introduce yourself so that the speakers also know who you are. Thank you.
Hi, I'm Christina. I'm so pleased to be here. Thank you, Nancy, for calling out the economics profession. I actually come from the mainstream economics profession, but my own personal journey has led me here, and I'm so excited to be here. I'm so excited to see all the different types of people and stakeholders coming together to create this sort of new space and field. And I also just wanted to ask, partly because I currently work with a nonprofit to influence capital and investors for feminist and gender issues, I'd like to sort of invite you to think about where can we invite capital here, and to think creatively and imaginatively about people, because capital itself is also very diverse. Capital has diverse ideologies. And I'm seeing that there are a lot of people with capital, particularly women, rich women, who want to do something about these issues of care. And I'd like to see your ideas about how to systematically invite them into these conversations if they are not being done so already. Thank you.
Oh, okay, I'm going to, I think the question is addressed to Nancy, but I'll let others also comment, answer the question. Go ahead.
So I wasn't sure if you were talking about capital with a little c or a big C or a little k or a big K. But I hear what you're saying, and I guess I truly believe it is completely in our collective interests, including the collective interests of capital, to develop a more sustainable and more equitable society. I think we could achieve huge efficiency gains by reducing inequality. And that would be my pitch for investing in a better vision of social insurance, that it would require a lot of reallocation in the short run, but in the long run, it would basically have such significant knock-on effects in terms of better human capital, better social capital, better environmental capital. I mean, I think I'm not averse to using the word capital whenever we can to kind of bridge, I don't know, to kind of build the kind of bridges that I think that you're asking about. And I think all those things really are capital. It's not just financial capital, and you know, all the capitals need to be brought together. But I have to say, I kind of prefer the word climate to capital, because I think it's these things that I'm talking about it's not stuff that we can put in the bank. And it's not as easily quantifiable or as fungible as what we think of as financial capital. But for dang sure, it's really crucial to the long run success of financial capital. So I think we should be combining some moral outrage and political energy with appeals to economic self-interest. So I really am an economist. I can't help it.
I can offer also maybe one other, I agree with what Nancy was saying. I think that, you know, in terms of all the different types of financial capital available, whether you're talking about philanthropic capital or, you know, the capital that you see being infused into early stage entrepreneurial activities, or, you know, different types of funds, whatever kind of capital you're talking about, I think that, you know, when it comes to inequality in this country, we are most often talking about a bottleneck problem, right? We have this surplus of capital stock that we need to transform into flow. So I am not an economist by trade. I was not trained in that at all, but I'm pretty sure maybe that's an ops thing, but you know, that's the whole point, right? There's this languishing capital just sitting in financial markets, not really producing anything, not really giving anything back, right? Just sitting there, going with the overall sort of index fund, whatever, and it's not really being used. And that's a talking point, I think, in terms of philanthropic capital. The other thing is that, you know, when you're talking about incentives, it is really going to take all of us to drive those incentives, right? So if you're talking about impact investor opportunities or angel investor opportunities for, you know, to flow capital into entrepreneurs in, you know, not just the coasts, right? And not just whatever the 93% of white, straight, cis males that, you know, receive venture capital funding in this country, right? You know, so you have to talk about the VC money, the early investor money. You have to talk about philanthropic capital. There's also an entire wing, I think, devoted to rethinking how philanthropic capital is deployed in the nonprofit space, which is really interesting. I don't have a lot of experience with that, but I just think that it's, you know, there is a way to do it, and we have to really think about the fact that this capital is languishing in our markets and needs to be put to use. And I think the other thing to be thinking about is what I said before in terms of redefining what the risk is of leaving that capital just sitting there, not producing anything for our economy. So, you know, when we're doing risk profiles of, you know, portfolios large and small, institutional or whatever, you know, we need to think about the risks of just that sitting there. And there's that whole other wing there then of what that means in the fossil fuel space and so forth, and stranded assets and all of that. And that's not the purpose of this conversation, but I do think that those are things that provide possibly useful guidance you know, in those communities that have been working to de-risk or to decouple, you know, to work and risk in those types of portfolios as it relates to climate, to Nancy's point, what are the, you know, how can we take that from a social climate perspective and apply that guidance there? Then I think that we would have a much clearer picture of where the incentives really lie and how we can really actively work to push to deploy that capital in a meaningful way.
I guess the only other thing I would add is mostly from an advocacy standpoint that, and again, not knowing what particular kind of capital you're referring to, I would be remiss if I didn't just say give all the money to family values at work. So I'll just start there. But then I think, you know, we're seeing a lot of experimentation amongst employers and experimenting with social programs at the local and state level. So, you know, I'm sure some people in this audience know a lot about universal basic income pilots that are popping up all over local and state level. And a lot of times those are financed by different levels of capital, philanthropic investments, and state and local dollars. And we're seeing employers also put more money into employer assistance programs that are starting to look more intentionally at particular caregiving programs that can go to supporting employees. So I think it really depends on what kind of capital you're talking about. But I think if we can start to draw a through line between values and investment and bring in this conversation around risk, I think you start to get closer to different levels of experimentation. I think that we're talking about. But I think the other thing just to say is that in this country, money talks, right? Like we all know that. I will never forget in the moment in federal advocacy, trying to figure out what we were going to do to really try to push, create a pressure point in the Senate. And one of our brilliant state partners was like, let's look at the top investors for Manchin, right? Like, who are his top individual donors? Lo and behold, 5 top capital venturists, white women, who all like innately surely had caregiving experience. What does it look like to really look at folks with capital and folks who are looking at the investment world and folks who are involved in political investments in a way that doesn't quite always line up to their own personal experiences and maybe not even their values. So I think there's like, you know, some of this is like, how much do you want to agitate and how much do you want to sort of like drive experimentation and solutions making? But I would also just like invite opportunities like this where you're pulling together the right people to talk then to the right people about some of the experimentation and some of what's possible.
Wendy, do you want to add anything? Okay, any other question from the audience? Yes, please, go ahead.
So thank you all so much for your comments. I want to kind of offer perhaps a self-interested question, but from a kind of zillennial perspective, since we've talked so much about multi-generational solutions, I think as a young person in this time, that we see the social climate and the actual climate deteriorating, and it's really ambivalent to think about caregiving and where I want to be in 10 years, right? I'm not sure I'll have the right to choose when I want to have a child. I'm not sure what the climate's going to look like in 10 years. But I'd love to ask you all where you want, when I'm ready to have kids in 10 years, where you want us to be. What changes do you want to have happen? What is the next 10 years going to look like in our caregiving responsibilities as the next generation? Big question.
Okay. Anybody wants to take the question? Go ahead. Go ahead, Nancy.
Well, I mean, to me, a lot of the provisions of Build Back Better encapsulated my hopes for where we would be in 10 years. It seemed realistic to me, and it still does, that we could significantly expand childcare services. And I think even if that stalls out on the federal level, that we can and should fight for it as hard as we can on the state level. And I feel the same way about home and community-based services for the elderly as the other part of the caring across generations. And I also think that paid family leave is going to, that we can move it forward. I'm not sure how far we'll get in 10 years, but I'm pretty sure that we are, we will be able to move it forward. And I would like to think, I think this was a point that Wendy raised, that we could also really rethink the issue of full-time work and work flexibility as a result of lessons from the pandemic, and also as an outcome of a tight labor market where workers may have some bargaining power to really fundamentally rethink the temporal and spatial organization of paid work. I know that I guess I'll just say, I know there are always a lot of unknowns, and I think we're facing a lot of really serious challenges, obviously, on a lot of fronts, economic and military and environmental, and to some extent are, let's hope that we can figure out a way to address those in the next 10 years as best we can. I think it's really important to think about our chances of success, but I also think it's really important not to think too hard about what those chances are. I think we need to fight for what is needed as best we can, regardless of our anticipation of the odds.
Thank you. Thank you, Nancy. Anybody else would like to respond? Go ahead, Wendy.
Yeah. I mean, you sort of situated your question with the forethought that, decisions you're making now, you're already taking into account this caregiving penalty that you're going to face, right? And we have all made those. I'm trying to avoid using the word choice because it's a structure, right? These because we structure jobs in the way that we do, because you feel, this is all back to what you said early on, Josie, like this is we are suffering this silently. This is actually should be a very loud exclamation point because it's not personal, and it shouldn't be silent. These things cost enormous amounts over each of our lifetimes and in our economy. So the way I heard you raise the question was, for the millennials of us, we are making decisions now that anticipate maybe 10 years from now, wanting to have a family. And I keep coming back to, I would like, we know how to solve the gender and racial wage gap. And these are like, we can close the gap. There should not be a caregiving penalty that we're all facing. These are really simple. Just Nancy ticked them off one by one. These are very straightforward solutions. We know how to solve them. So 10 years from now, I hope there is no caregiving penalty that you're facing because we have done these things that we know we need to do, have long known that we need to do.
And I will just add to that I think the thing to pay attention to now, because we know the solutions, because we've seen solutions piloted, right, at the state level and within the pandemic, the thing to really, 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 really pay attention to now is democracy and our access and engagement in democracy. I think if we are not paying attention to city, state, local, and federal elections, making sure that these conversations that we're having in this room are then happening with our friends and with our families in a way that connects people and moves people out of this lethargy around engaging in democracy and engaging in their right to vote. I think we're going to miss these key critical opportunities to enact legislation, right? Because there's some of this that's programmatic, there's some of this that's employer responsibility, there's some of this that's, you know, on us to have the tough conversation, but a lot of what we're talking about is policy and legislation that can only be enacted at the local, state, and federal level. And if we're not voting our values, if we're not activating educated voters, if we're not connecting these issues that we're talking about to how people vote and who they vote for and how they're paying attention to state and federal elections, we're going to like constantly cycle in these windows where we're oh so close. And then we're thinking about another 4-year marker and another 2-year marker. And before you know it, that 10 years is coming tomorrow without the political landscape necessary that has created a level of political power and political courage to actually enact the solutions that we know we need to take. So if everybody was gonna wipe their workplace clean, I would say go knock on every door and have every conversation possible about connecting these conversations to how people vote.
Thank you. Carolyn, you want to?
I mean, I agree with what else, you know, what's already been said. I think, you know, in terms of 10 years, there's so many things at play. I mean, technology, we still don't really understand the implications of what, you know, going beyond digital into virtual and these new spaces that we, you know, those landscapes are as yet defined. And so it's very difficult to say, at least for me, how that is going to impact care, how we think about care and defining work. Given the pace, you know, of technology in those realms. I would say that, you know, what was told to me by a mentor when I was younger is, you know, be sure to be engaged in creative activities, you know, read fiction, read Octavia Butler, read Donna Haraway, you know, read those types of things, go, you know, see film, and really just as much as you can cultivate a creative part of your life, because I think that with all of these dynamics and the pace, you know, going at the speed, it really requires all of us who care deeply about this work to continually find creative ways to not only respond, but to carve out a path for the future. So I'm just going to make that plug, read more fiction. Yes.
Well, thank you. I think we've run out of time. There are a lot of useful information in the chat. So please, you know, read them. And I think there's some very useful websites as well. I'm going to like to thank the organizers of this wonderful conference. Really, really very informative and also very timely. Nicole Mason and Ariane Hedgewich of IWPR and the wonderful IWPR staff that has made this possible, together with their partners, Program on Gender Analysis and Economics at American University, in particular, Mika Mewers and the wonderful RAs and graduate students that have helped put this together, and of course, CareWork Network. Thank you very much for attending this conference. And I think, is there any information from the organizers that you want to add?
Well, the videos I think will be posted in, you know, appropriate amount of time.
Okay. Yeah. Well, thank you very much, Carolyn, Nancy, Wendy, Josie, for joining us in the closing plenary of this conference. Thank you.